Good afternoon. Thank you very much for joining us for the fiscal year 22 annual enrollment presentation for our retirees. We're happy to have you join us today. My name is Mary Lockenbrook, and I'm the Director of Benefits for the Montana University System. And on behalf of the Commissioner of Higher Education and all of our benefits staff here at OCHE, I would just like to welcome you to this new annual enrollment period for fiscal year 22, which will run from July 1 of 2021 through June 30 of 2022. Our agenda today will be much like you've seen in past years. We'll talk just briefly about what it means for us to be a self-funded plan. We'll talk about our annual enrollment dates, and then all of our benefits, including medical, pharmacy, dental, vision hardware. And then we'll talk about what the plan rates look like for fiscal year 22. And then our Take Control program, some new program offerings, premium payments, and some enrollment reminders. We will have an opportunity for you to hear from Ginger McDonald today. She is our account manager from Blue Cross Blue Shield of Montana, and she will walk us through some information specific to Blue Cross Blue Shield of Montana. So with that, let's just start with some information that most of you are probably aware of. But that is that the Montana University System operates a self-funded health plan. Our benefits, including medical, prescription drug, dental, and vision hardware, are all self-funded. And what that means is that the contributions for premiums go directly into a fund that is used to pay the cost of benefits for all of our university system plan participants who experience illness or injury or have any costs associated with benefits available under the plan. So that could include preventive services and others as well. In order to ensure that our plan remains financially sound and affordable, it is important that all of our plan participants use their benefits responsibly. Some ideas of things that we can do to ensure that we're using benefits responsibly would include things like making sure that we're getting all of our necessary preventive care, things like cancer screenings, flu shots, anything that would help us maintain or improve the quality of our health. In addition, to ensure that we're using providers that are in our network. So if you have questions about that, you can always reach out to Blue Cross Blue Shield on the medical side, or you can reach out to our benefits office here at OCHE, and we can help you walk through that as well. We do ask our plan participants to pay a portion of medical costs in the form of annual deductibles, a percentage coinsurance, or flat dollar co-payments. These cost containment features are part of our plan design, and it helps us ensure that funds will be available in the event that a high-cost medical emergency or a catastrophic or chronic illness should strike one of our plan participants. It's really important to us to ensure that we are on a solid financial footing so that anything that may come our way to any of our plan members, we are certain that we have the means to cover them. So annual enrollment is just about to commence. Annual enrollment will open next Monday, April 26th, and it will close on Friday, May 14th. So these dates really align with what you've seen in the past. It's really important, though, that you make sure that if you want to make any changes for the upcoming year, that you get them done within this annual enrollment window. Some good news in terms of your retiree medical plan benefits. There are no changes to your basic benefits for fiscal year 22. So by that, I mean there's no change to the co-pays, to the coinsurance, to the individual or family deductibles or out-of-pocket maximums. We've just put on the slide information about in-network benefits, but there are no changes to your out-of-network benefits either for the upcoming fiscal year. And again, your eye exam, whether it's routine or medical, the first one per plan year with an in-network provider processes on your medical plan, and there is no copay. A couple of new enhancements really to your plan. First of all, telemedicine visits. Those were added in the spring as the pandemic took hold, and there was some really rapid succession of federal legislation. In mid-March, we saw signage of the Families First Coronavirus Response Act, and that was where we initially saw some requirements to provide or to allow for the provision of benefits via telemedicine or telehealth. There were some pretty stringent requirements at that point, but a couple of weeks later, toward the end of March, we saw the CARES Act signed into law, and that created some flexibility around telemedicine visits. We've gotten through the really critical time where we had people really voicing a need for telemedicine services, whether it be for mental health counseling or for primary care visits. But we've also heard that these benefits make a difference to our people. So our Inter-Units Benefit Committee did vote to provide telemedicine ongoing as part of our plan. So those benefits will continue, and you will no longer need to be checking in with us on a regular basis to see if you can still receive services via the telemedicine benefit. The next change has to do with outpatient rehabilitative services. Now, keep in mind that these services include physical, occupational, speech, cardiac, respiratory, pulmonary, massage therapy, acupuncture, and chiropractic services. Currently, there is a combined visit maximum of 30 per benefit year. Effective July 1 of 2021, that will increase to 60 visits per plan year. But it's also really important for me to emphasize that the 60 visits will be a hard limit. And by that, I mean that we will not be routinely reviewing physical therapy services, for example, to determine if perhaps an extension should be granted. It will be 60 visits as a combined maximum, and we encourage our plan members to really make sure that you are aware of the 60 visit limit and that you are monitoring where you're at throughout the plan year. And we will also ask that providers monitor these services as well. And then we've added the website if you're interested in being able to find if your provider is in network with Blue Cross Blue Shield of Montana. You can access information via the website, or you can call Blue Cross Blue Shield directly, or you can call our benefits office and we will help you with that navigation as well. As you know, Blue Cross Blue Shield of Montana is our only third-party administrator now for our medical claims and our vision hardware. And so you are able to utilize the network not only in the state of Montana, but the Blue Card network, which is expansive throughout the nation as well. The prescription drug plan also is not changing. Navitus Health Solutions will continue as our pharmacy benefit manager, and Luma Sarah will continue as the specialty pharmacy for the university system plan. For those of you who may be not Medicare primary, so are under age 65 retirees, please keep in mind that for you, CVS, Target, and Western Drug pharmacies are not in our network. If you choose to use these pharmacies, you can do so, but you will be responsible for all charges. That is not the case for our Medicare primary members. Those of you who are on our Medicare Part D and our EGWIP, our employer group waiver plan, you may use the CVS, Target, and Western Drug pharmacies. Keep in mind that your prescriptions can be filled at a participating retail pharmacy for a 1-month supply or a 90-day supply. We have monitored utilization since we made the change a couple of years ago, and it does seem that our retirees are taking advantage of the opportunity to be able to fill a 90-day supply at a retail pharmacy. So we're glad to see that that appears to be a value-added benefit, and we plan to continue that. You can also still get mail order prescriptions for a 90-day supply through Ridgeway, Costco, or MyRx, but please keep in mind MyRx only delivers to Montana, Idaho, Washington, Wyoming, and North and South Dakota. So there are no changes at all to your copays on the prescription drug plan. They will remain exactly as they are today. I would just remind you that if you have a coinsurance, so a tier 3 drug with a 50% coinsurance, or a tier 4 specialty drug that you purchase at retail, which has a 50% coinsurance, those do not apply to the out-of-pocket maximum. The out-of-pocket maximums also remain the same for fiscal year 22. They will be $2,150 per individual or $4,300 per family. Medicare retirees will continue to be enrolled in our Navitas Medicare Part D prescription drug plan. And just a reminder that Medicare retirees must be enrolled in Medicare Parts A and B and cannot be enrolled in another Medicare Part D plan. If you are not enrolled in Medicare Parts A and B, you will be disenrolled from the Montana University System medical plan. And remember, medical and pharmacy go together, so it would be both. The University System Medicare primary retiree plan members cannot be covered on another MUS Medicare primary retiree plan as a spouse. We refer to that as dual enrollment. So just keep that in mind. If you have two of you are married and you were both covered by the university system, you would each have your own retiree insurance. You cannot be covered under two. And then a reminder, I think that most of you are used to this now. I know it was something that was a little bit difficult to wrap our arms around in the beginning, but I think most are used to it now. But Navitas Medicare pharmacy eligible members are enrolled as an individual, not as a family. And that is because these are Medicare rules, and that's what is triggering these types of enrollment situations. And Medicare runs on a calendar year, and the university system runs on a fiscal year. So if you have two household members and one is Medicare primary and one is not, then you would be in a situation of having a split family where one is on the commercial plan and one is on the Medicare plan. And again, just a reminder that Medicare primary members, your accumulators on the prescription drug plan are calculated on a calendar year basis. Again, we will have an opt-out period this fall that coincides with Medicare's enrollment timeframe, and that will run from October 12th through October 29th of 2021. So that will be an opportunity if you choose to opt out of the university system plan for a January 1, 2022 effective date. And then just a reminder that this is not just an opt-out for pharmacy. If you opt out of the pharmacy benefit, you are also disenrolled from the university system medical plan. And then I just wanted to touch on the Copay Max program that is administered by Navitas. This program does not apply to our Medicare primary retirees, but it does apply to retirees who are under age 65. And this is a program that creates a benefit designed to leverage copay assistance cards that are provided by manufacturers to reduce the member and plan costs. And in a nutshell, what happens is the pharmaceutical manufacturer's assistance is applied and the patient pays $0 out of pocket. And then the plan also may see a benefit with this program, depending on what the pharmaceutical assistance is and how long it lasts. A new program that we are opting into with Navitas for fiscal year 22 is the Semper Health discount program. This also only applies to pre-65 retirees. It does not apply to our Medicare retirees. And this is a text messaging program that is designed to improve adherence and affordability for those who have medications for chronic diseases by lowering copays for members when they fill their prescriptions consistently and on time. So it's really an effort to increase medication compliance. It is a brand new program, and right now there are not a large number of medications that are a part of this program. There are some anticoagulants, Eliquis, Pradaxa, and Xarelto. And then just recently, 2 anti-diabetics were added, and those are Farxiga and Jardiance. Those two are also in this program. And if you're eligible, you will get an opportunity presented to you to enroll. And once you enroll, the way that this program works is, again, it's a pharmaceutical manufacturer program. And when you have filled a prescription that is part of the program consistently and on time for a period of time, I'm going to give a hypothetical example. It might be that it's 3 months, you fill it every month on time, then the pharmaceutical manufacturer starts to contribute some assistance that results in a lower copay for the patient. So for instance, if you're taking a prescription that has a $50 per month copay, and for example, this drug has the 3 months of consistent on-time refills, when you hit that, then maybe the next month you might see a copay of $40. And it might go down then after a few more months to $30. On the flip side of that, if you've received, let's just say that your copay is down to $40 because of the manufacturer assistance, and then you don't fill it on time for a few months, then the next time you go to fill it, your copay may be back to the $50, but it will never exceed the plan's set copay amounts. So there is in no way any kind of a penalty to a patient, but there is an opportunity for you to get an incentive if you are filling consistently and on time. Now we'll move from pharmacy onto the retiree dental plan benefits. There are no changes to the plan design for fiscal year 22. However, we are increasing the fee schedule reimbursement maximums for many of the dental codes for the upcoming fiscal year. There is no change to your premiums. I'm happy to tell you, retirees, this will be year 9 of no increase to your dental premiums. So we are able to add some reimbursement amounts for some of the codes and still keep your premiums flat. Keep in mind your select dental plan covers diagnostic and preventive, basic, major restorative, so really comprehensive dental coverage, along with orthodontia services. Orthodontia has a $1,500 lifetime maximum. Your basic and major restorative have a $2,000 annual maximum per member. And the diagnostic and preventive services do not apply to that annual maximum. That's important because in the event that you do have some major services one plan year, and let's say you have to have a root canal and a crown and a bridge, and that ends up getting you to your $2,000 annual maximum, we still want you to be able to get your teeth cleaned. And if you are due for your bite wing x-rays, those preventive services are still covered. So according to the fee schedule reimbursement, of course, but the diagnostic and preventive do not apply to that $2,000 annual maximum. The vision hardware benefits, there will be no change in your premiums for the optional vision hardware benefit. Keep in mind, this is only hardware. So this is your frames and lenses or contacts up to a $300 annual allowance per covered member. That's for frames and lenses. Contacts, we are making a change for fiscal year 22, and we are increasing the allowance from $150 to $200. Again, this is one purchase per plan year. So if you do use contacts, you may want to buy them, for maybe 6 months or 12 months, whatever would give you the best benefit, because it is a one purchase. And the eye exam, again, is covered under the medical benefit, $0 copay if you're using an in-network provider. Now on to your medical benefits for fiscal year 22. I'm thrilled to tell you there is no increase to your premiums on the medical plan. This is the second year for retirees that there is no increase on any of the medical plan premiums. So they will look exactly as they do today for both non-Medicare retirees and for the Medicare retirees, no changes at all. Same is true of your vision hardware and dental, no changes to your premiums. And then just a reminder for those of you who may be pre-Medicare retirees, so under age 65, we do still offer you the Take Control Lifestyle Management Program. And this is a comprehensive, confidential, voluntary education and support program. It is for conditions including high blood pressure, high cholesterol, weight loss, diabetes and prediabetes, tobacco cessation, and we include maternity via the Well Baby program, though we have yet to have a retiree take us up on the Well Baby maternity program. With that, I am going to turn it over to Ginger MacDonald from Blue Cross Blue Shield. I think you will be interested in the information that she has to provide with regard to access to information, as well as some add-on programs that we're adding to the plan as of July 1.
Thanks, Mary. Hi, good afternoon. This is Ginger MacDonald. I'm your account executive at Blue Cross Blue Shield. I was going to walk through our Blue Access for Members portal and what's available to you out there. Now, this is currently available to you, so you don't have to wait for 7/1 to start accessing this information. If you go to our website at bcbsmt.com, you'll see where you can register for BAM, for Blue Access for Members. And out on BAM, you'll see several different things, including you can manage your ID card. If you lost an ID card, you can order another one. You can take a peek at your claims that are coming through. You can look at the benefits that are available for you. There are some discount programs out there, which we're going to go into a little bit further. And then there's Well on Target, which is our wellness portal. And again, these are available to you now. So let's take a look a little bit deeper. Once you get into BAM, this is the first page you would see. For instance, this is showing how much of the deductible and out of pocket have been met for the family. You also have access to find a provider. Mary was talking about this a little bit earlier. Out on our website, you can look for providers that are in the network, and you can do that under tab number 4, Doctors and Hospitals. And then if you see that number 6 that's off to the left, those are some quick links that we're going to talk about as well. Wonder Health is actually a brand new program that we have available for you. This will actually begin 7/1. So look for more information on this if you are interested. So what Wonder Health is a digital metabolic syndrome reversal program, which means it helps with weight management and diabetes prevention. There are a couple of different platforms that you can sign up for. You can do just simply a 10-week counseling session. You can turn that into a 20-week session, and then you can continue on that and maintain what you've learned and continue for 1 full year. These are done digitally, so they are out online and they're self-paced. That means you can do it whenever you feel like doing it. You can take some of the classes back to back if you would like. You have interactions with health coaches, and there's some social support out there. And this is available to all MUS medical plan participants that are over the age of 18. There's no cost to you, the member. So again, be looking for some more information on this as we get closer to 7/1. The other program that will be brand new on July 1 is Hinge Health. This has to do with musculoskeletal management, and this is helping with back, knee, hip, shoulder, or neck pain. This one is a 12-week program, and when you sign up for this and get accepted into the program, you will be sent a tablet and wearable sensors, and then you're going to walk through some health coaching one-on-one with an exercise therapy coach. This program is done remotely. It's all done mobile, using your application that is preloaded onto that tablet you receive. So you open it up and you can click into your application and you'd be ready to roll. This is also available at no cost to you members. And enrollment for this will begin after July 1. So if you're interested in this, just keep a lookout for more information. Okay, and we're going to go back to well on target. So this is what we were talking about within our Blue Access for Members portal, the BAM portal. So let's talk about what's on well on target. So once you're out on the Blue Cross website, you would go out and register for BAM, for Blue Access for Members, and that yellow arrow is indicating where you would start. Pretty simple once you get out there. And then once you're on BAM and you want to get to well on target, off on the left side panel, you'll see this well on target link. Out on the well on target portal, you see all of these things that you can access and utilize. So you can do a health assessment out there. There's a dashboard, and that's keeping track of whatever you have logged out there, whatever you have synced up through your Fitbit, whatever activities you've logged. These are all out here on your dashboard. Also out here is probably the best part of it, and that's the Blue Points rewards. As you are utilizing the Well on Target portal, you are gaining points for every single thing that you do within the portal. So if you have a Fitbit and you sync your Fitbit to Well on Target, you earn points every time you work out, every time you go for a walk. And with those blue points, once they've added up a little bit, you can go out to redeem those points, and you get to go do a little shopping. And it's kind of like an Amazon experience. So fun stuff too. I mean, if you're out there working out and walking, doing whatever anyway, you may as well earn some points for it and get to go shopping, right? This is what your dashboard would look like, telling you how many points you are earning for everything that you're doing. And again, we're going to sync those up with your fitness app or nutrition device. We also have a fitness program. This is accessible also on BAM. The fitness programs around the state kind of vary. If you're in one of the bigger towns in Montana, you may have access to up to 7 different gyms. If you're in some of the smaller towns, you may have access to only 1 or 2. The good news is if you belong to a gym and you would like them to join this fitness program network, you can nominate your gym out online, and our fitness program will reach out to that gym and see if they can get them to join the network. So there's 4 different levels of the fitness program, as you can see up at the top left. And they just vary by type of fitness center. If you currently belong to a gym and you love it and they are a part of our network, you would go out to BAM, go to the fitness program link. That will give you a card, and you would take that card back into your gym, and they will hook you up through the fitness program. So then you'd start earning those blue points. Always On is the app that syncs up to our Well on Target. So it's basically everything that you would see if you had just logged in on the website. But there is also a nutrition integration part of the application as well. So it would monitor things like calorie intake or what your target might be, carbs, if that's what you're watching, just a basic nutrition integration. And Blue 365, if you've ever heard me talk in front of you, I've been working with the MUS for years and years, and I've talked about Blue 365 for several years. This is a discount program, and this is available to you right now. It is simply a discount program in that you can go shopping out here with your Blue Cross Blue Shield card, and if you find something you like, they're offered at a discounted price because they have a partnership with us, with Blue Cross. So specifically out there, something you may be interested in is a hearing aid benefit or There's some LASIK vision services that are available at a discount. Other things that you might be interested in are like Nutrisystem. If you wanted to try that, you could get that at a discount. Or if you wanted to get some new walking shoes, you can get some Reeboks at a 35% discount. So things like that are out on Blue 365. You would find that on our website when you log into BAM, and it's called Discount Programs. Okay, and this is not necessarily new, but it probably is new looking to you. This is some information on our Blue Distinction Centers. So this is another function of Find a Provider out on our website. When Mary was talking about staying in the network, we do that at Find a Provider on our website. Also out there are these specialties, the specialty care facilities, and they're listed below there. You can see Blue Distinction Center for Bariatric Surgery, et cetera. So there's 6 different types of specialties that are out here, and these Blue Distinction Centers, they have exceptional quality. They specialize in the services that you see in front of you. So for instance, if you or somebody in your family is needing a transplant, it would be highly recommended to go out and look at the Blue Distinction Centers, because this is what they specialize in. This is what they do very well. So we're looking at the best quality care and also trying to save you some money as well. There is a PDF available for each one of those service categories that are listed out. So for instance, if you're on the website, you're Find a Provider, you're looking at these Blue Distinction Centers, you would click on the bolded black facilities, and that would pull up the facilities that are available to do those services as a Blue Distinction Center. So again, these are hospitals that specialize in specific care. You can find those out on our website. Another super easy way to access these, the names of our BDCs, is to simply call customer service. That's a really simple thing to do, and our customer service team loves to answer those types of questions for you. So again, you would find this out on our website, or simply make a call to customer service.
Great, thank you so much, Ginger. So with that, we will move on then to a couple of other offerings. And these, similar to the hearing aid discounts or the LASIK eye surgery discounts through Blue 365, Delta Dental, as our third-party administrator for dental benefits, they also have given us access to savings opportunities on both hearing aids and LASIK eye surgery. These are offered through programs called Amplifon and QualSight. So again, these are discount programs. They're not a part of our benefit plan, but they are at no cost at all to you. So if you're interested in these services, there are a couple of options that can be researched. And the savings are anywhere from 40 to over 60% off of what you would normally see as a retail price or a national average price. And they have a nationwide network of providers. So if you're interested in these, there are websites listed here for both Amplifon and QualSight. The one caveat I need you to understand, though, is that you cannot access both the Blue Cross discount programs and the Delta Dental discount programs and stack them. So you need to choose one or the other, which may require you to do a little bit of research about these programs, providers, those types of things. But 2 really good opportunities for you to save some money if you need hearing aids or LASIK eye surgery. The plan and our Inter-Unit Benefits Committee on a very regular basis talks about specifically hearing aids, as we receive quite a few inquiries every year about why we don't cover hearing aids. So we will continue to review whether or not there's an opportunity for additional benefits. But at this time, we at least wanted you to be aware that while they're not covered under the medical plan, you have two exceptional opportunities here to access hearing aids through these discount programs. So your retiree premium payments, again, the good news is you will not see any changes in your premiums. If you are a direct bill retiree, meaning you receive your premium notifications from Business Solver and you send your money to Business Solver, you will continue to submit your payments directly to Business Solver. They do not go to your campus and they do not come to our office here at the Commissioner of Higher Ed. Business Solver does offer online payments. You can access that from the Choices homepage at our website. You can set up ACH transactions through your bank, or you can send your payment in monthly. The direct bill statements will continue to be sent out monthly to all of our current direct bill retirees. And if you pay your monthly premiums via TRS retirement system or the PERS retirement system, you will continue to have those automatically deducted from your plans. If you need to change or you want to change your premium payments from your TERS or PERS plans to direct bill as of July 1 of 2021, you will need to contact your campus HR benefits office to help you make this change. And then just a quick view of what you will see on our website. You can see that there is information including enrollment books, our summary plan description, as well as information about annual enrollment on the website. And then we've just included the welcome screens to get into Benefit Solver. So if you already have been into the platform, you should have a username and password. If you have not been in, you would need to register a new account. This is especially important for those of you who want to set up ACH payments or look at your account status in terms of payments. And then just a few enrollment reminders. Our annual enrollment will begin next Monday, April 26th, and it will close on Friday, May 14th. If you want to make changes, your enrollment form must be submitted to your campus HR office by May 14th. If you do not submit any changes, you will automatically be re-enrolled in whatever you have today. Your choices letter was mailed out on April 5th, and your retiree books and enrollment forms were mailed out last week. We did post everything online this morning, so you should have access to the workbooks online as well. And today's presentation is being recorded, and it will also be available on our website by next Wednesday, April 28th. So just a final reminder to utilize in-network providers. Obviously, we understand that in a medical emergency situation, you may not have time to do your research, but anything elective or anything that is not a true emergency, we encourage you to check to make sure that your providers are in network. This is huge to you because, of course, in-network providers accept the allowable, so they would write off any difference between their charge and the allowable amount. And with that, I would just say thank you so much for your time today. Thank you for being valued members of our plan. And if you have any questions, we have staff here available to answer questions, and we'll leave our line open for the next 5 minutes or so. Thanks so much. Have a great night tonight.